It's very difficult to think about COVID-19 purely in terms of mortality rates. You have to think about some of these other types of consequences and people who did recover and survive the initial infection. Unfortunately, the differences between the two are not that big. You could equally have a cough and a fever and feel fatigued, and that could mean you have the flu. That could mean you have COVID. The only way it's going to be to know for sure is to get a test. Now, the one symptom that does look to be a little bit different with COVID is losing that sense of smell, losing a sense of taste, but that doesn't affect everyone who has COVID. And luckily, some places in the southern hemisphere, like Australia, for example, did see a relatively mild flu season this year for two reasons. One, they had much greater uptake of people getting the flu vaccine than they do typically in other years. And number two, it's combined with the measures that people are taking to reduce risk of COVID already. With those two combined, they had an extremely mild influenza season, and we can hope that we're going to have the same here. Generally, I think fear of COVID-19, it can have a couple of different interpretations. One is sort of in the context of you're respecting the dangerous potential that a COVID-19 infection could have, either for you or through you as a vector for people around you who are more susceptible to severe disease. That appreciation for that potential danger is what motivates, to use proper PPE, to wear a mask, to social distance, to use good ventilation if you're indoors, or to meet up outdoors instead. On the flip side, it's not really necessary to live in fear of COVID-19. And there's a distinction there where as long as you are taking all of those protective measures that you can do to reduce your risk as much as possible, from that point, there's no sense in thinking about it then 24/7. Hand sanitizers are extremely effective as long as you meet these two key criteria. One of them is that the alcohol content, assuming it's an alcohol-based hand sanitizer, has to be north of 60 to 70%. If you use the 30%, it's not going to do the trick. Thing number two is contact time. So you need that to be on your hands probably for at least 10 to 15 seconds. If you put a small little drop and it evaporates instantly, that doesn't give the sanitizer enough time to fully inactivate that virus. And so it's kind of like a nuclear weapon where it's just totally blowing up the entire pathogen without giving it a chance for mutations to have an impact. Yeah, things will go back to normal. The best case scenario is that people start wearing masks more, social distancing more to slow down the spread naturally, combined with the development of an effective vaccine that's, prevents infections in 50, 60, 70% of people or something, combined with pretty good uptake of that vaccine, combined with a good therapeutic. What makes it such that if you still receive a COVID diagnosis, your odds are much better than they are now or better than they were 3 months ago. A lot of people kind of think this way, that once we have a COVID-19 vaccine, pandemic is over. But that's not quite how it's going to go, most likely. It's still going to be a combination of that vaccine is rolling out, not everyone gets it at once, and so there's going to be a gradient of more and more people are protected over time as they get vaccinated. What we have found is that very clearly there are consequences after recovering from a COVID-19 infection. It's not a binary event. You don't get infected with COVID and then either die or be totally healthy, right? There's a chance that you recover from the initial infection, but you still have lasting health consequences, and we're beginning to understand those now. One example is particularly in severe disease, you can have scarring in your lungs. That scarring in your lungs can decrease lung function, it can make you feel more fatigued, it can decrease your exercise capacity, it can cause decreased quality of life, even though you recovered from disease. And for that reason, it's very difficult to think about COVID-19 purely in terms of mortality rates. You have to think about some of these other types of consequences and people who did recover and survive the initial infection. The other types of things that we're seeing is damage to heart muscle. Even in patients who have relatively mild COVID-19 infections, it doesn't take severe disease to cause these sort of systemic effects. Neither masks nor social distancing on their own are going to be 100% capable of protecting you or other people from infection, right? Even if both of them, cause an 80% reduction in exhalation of droplets that may contain virus, and social distancing reduces the dose of viruses that you're going to receive by another 80%, neither of those are good enough. But when you stack the two together, they kind of multiply, right? And so it's the combination of all these little things that we do. There's the hand washing, the mask wearing, the distancing, having the good ventilation. eventually, hopefully having a vaccine in there as well. It's all of those combined, stacking up, that really, really reduce your risk. One of the key things that we didn't really know at first, or at least didn't appreciate at first, is how many infections are caused by people who don't have symptoms at all, either because they are in that couple-day period before they develop symptoms, or people who are infected who never end up developing symptoms. Combined, they account for almost half of the new infections that get started. We didn't really understand that well at first. The second big thing that we have learned over the course of the pandemic, and this is made possible through big contact tracing studies where they look at someone who's infected and then they go back and they look at all the potential infections that resulted, is that there's huge variability in how many infections are caused by each infected person. So 80% of people who are infected infect relatively few people, maybe 0 or maybe 1 other person, maybe 2 other people. But then there's a small fraction of infected people who account for the vast majority of new infections. And that's difficult to predict. You can't tell that from necessarily a COVID test. You get a positive test result. You don't know whether you're going to be capable of shedding these huge amounts of virus to infect lots of other people. But we know now that that has a big influence on the trajectory of the pandemic that we've seen so far.